Masks. To wear or not to wear? That is the question. Humans are one of God's most supreme creations. He gave us powers to think, to assess, to analyze, and maybe much, much more. But what did humans turn on to do? Overthink, overassess, overanalyze any type of a situation. And masks is definitely one of them. Welcome to TELC. I'm your host Sailesh, and this is part 2 of my multi-part series of videos on Canada's effort to overcome the pandemic of our lifetime. When you get sick, what do? You go to a doctor. The doctor suggests you medicines, you start taking them. After a while, you tend to feel better and life comes back to normal. Today, we are attacked by a deadly virus. And we all know that this virus is spreading through respiratory droplets. That is, you touch an infected area and you touch your mouth or nose. So the doctor says, wear a mask so you can be safe. And if you have the virus, you can avoid spreading it to others. Sounds simple? So where did the rights issue come from? As you are growing up, did you listen to your parents and follow their directions? Don't you listen to your boyfriends, girlfriends, or spouses and oblige to their requests? Don't you want your children to listen to you and follow your advice? All along our lives, we have followed doctors' advice, taken them for our good, and lived our lives. And today, we are overthinking, overassessing, and overanalyzing. And best of all, rights? With our neighbors to the south, it's political. The president says he won't wear a mask and his followers won't wear it too. Watch the CNN report on a couple of things which Canada has done better.
Vigilance has been the watchword. Early and widespread testing, a free healthcare system still building surge capacity, longer shutdowns, slower reopenings, social distancing, and there is no controversy over wearing masks. Most see it as their duty.
I wear it for myself and others. It protects them from me and me from them. It's just respectable to being respectful to other people.
Right from the top down, they're leading by example in terms of their use of masks.
Dr. Henry points to something else that was critical, keeping politics out of the response. Here's a conservative leader praising the Liberal Deputy Prime Minister.
Chrystia Freeland, what can I say? She's an absolute champion.
It would be like a Democratic governor calling Vice President Mike Pence their hero.
So what is the message I'm taking out from this? No controversy over wearing masks. Take rights and politics out. Apart from this rights and political issue, I'm sure God would have thought that humans will be considerate to one another. Here is something that I read which had a deep impact on me in making this video. I'll read it out to you as is. I wear a mask in public for 3 reasons. 1. Humility. I don't know if I have COVID, as it is clear that people can spread the disease before they have a symptom. Number 2. Kindness. I don't know if the person I'm near has a child battling cancer or cares for their elderly parents. While I might be fine, they might not. Number 3. Community. I want my community to thrive, businesses stay open, and employees to stay healthy. Keep a lid on COVID helps us all. A couple of expert studies shows that masks are better than disinfectants for COVID-19 preventions. Here are a couple of videos. Take a listen.
Instead, they argue that 3 simple things can end this pandemic. Washing your hands, wearing a mask when you're out and about in public, not getting too close to people when you're in busy places. Do this, the lead author on this study, Dr. Hanna Raznova, argues, get 50% of people, half of the country doing this, and very quickly the coronavirus pandemic will be over.
Absence of a vaccine could be our best weapon. Jeff Semple, Global News, Toronto.
There is also another myth about wearing a mask can decrease oxygen level, causing you brain damage. Really? Okay, if you have a medical condition, alright, sure, you're not stepping out of the house, you're not interacting with a COVID patient, I'm sure you have doctor's guidance on how you go about it. But for those who think it can reduce oxygen level or causing a brain damage, take a look at this video.
So this is an oxygen sat probe.
We put that theory to the test, checking my oxygen levels while wearing a surgical mask, then a regular cloth mask, and finally, a medical grade N95 mask.
And 100%. As you can see, the oxygen saturation doesn't change whatever mask you're wearing.
I even tried wearing all 3 masks simultaneously.
At 99% with all 3 masks.
Not comfortable, but
I know.
Dr. Thasleem Nimji and her colleagues wear masks all day, every day.
For long procedures, surgeons and those in the room are wearing masks and able to perform your surgery without any concern about their own safety.
On the lighter side, let's look at some of the companies, how they're promoting their mask sales. Immunobread. This bread has the following immunity ingredients like turmeric, ginger, cloves, black pepper, cinnamon, cumin, and jaggery. Wow, and guess what? You get a free mask when you buy this bread. Trikini or Trikini. How about this? We know bikini, and with the mask, now you have a trikini. Okay? Very innovative. Winter is coming. So you have to be prepared with this mask. How about that? Last but not the least, mask with Bluetooth. Wow, you don't need to hold the phone in your hand anymore. How convenient is that? Jokes apart, please take this message seriously. Wearing masks can definitely save the virus from spreading. So stop overthinking and overanalyzing and just do your part in wearing masks and save mankind. Thanks for watching my video. If you liked it, give me a thumbs up and subscribe to our TELC channel to watch more videos. I'd like to thank our channel sponsor, Universal Immigration, and look forward to talking to you all again. Thank you so much.